Hello there and welcome to another video from ARC Men's Health. In this video, I'm going to cover in brief the highlights of 6 different treatment options that men dealing with erectile dysfunction will typically encounter as they speak with their medical team. And as a hint, the 6th option is the treatment option that the ARC Men's Health team specifically recommends and promotes to our patients. So please stay tuned until the end, where we reveal what we think is the best option. So let's get started. Option number 1, drugs. Over the last couple of decades, the most known and marketed option for treating ED has definitely been medical pills like Viagra, Cialis, Levitra, and others. These are typically meant to temporarily treat the symptoms of ED and must be used before every sexual encounter. While effective in its purpose to promote readiness for sexual activity, these pills do come with unwanted side effects and, unfortunately, cannot be prescribed to most men with heart or liver health conditions. Option number 2, injections. Penile injection treatment is where medication is injected directly into the penis to stimulate an erection within minutes. Similar to pills, it must be administered before every sexual encounter to realize its temporary benefit. Though effective to achieve erections for sexual encounters, many men find this approach overly invasive and painful. Option number 3, surgical implants. A penile prosthesis is another treatment approach for men with erectile dysfunction and typically tends to be more lasting. To describe the prosthesis simply, these devices are either bendable or inflatable rods surgically implanted within the erection chambers of the penis. A large majority of men surveyed who have undergone this surgical procedure and live with the implant do claim satisfaction with the treatment option from a sexual health perspective. However, due to its highly invasive nature, the penile prosthesis is not the preferred option for many men, and there are serious risks to consider. These include the fact that once a penile prosthesis is implanted, it may destroy any natural erection reflex. Men usually cannot get an erection without inflating the implant, and if the implant is ever removed, natural erections may not be possible. Now, additional complications from such a surgery include uncontrolled bleeding after the surgery, possibly leading to reoperation, infection of the penile region, scar tissue formation, erosion of tissue around the implant which requires removal of the prosthesis, and mechanical failure of the prosthesis leading to reoperation and removal. Option number 4, vacuum erection devices. These devices are used to mechanically create an erection without requiring an implant. Generally thought to be non-effective long-term, they may work for some men as a temporary aid for sexual activity. Vacuum erection devices, unfortunately, do not have a significant impact on the underlying causes of erectile dysfunction. They're a bit clumsy to use, and like pills and penile injections, must be used before every sexual encounter. Overuse of such devices is not recommended, as it can cause impact to the penile vessels over time, which may lead to longer-term damage. Option number 5, herbal remedies. When it comes to naturopathic treatment options, red ginseng and Panax ginseng has gained popularity since researchers concluded that there is suggested evidence for its effectiveness. An anti-inflammatory herb, red ginseng has shown results in those with high levels of lipids in their blood by increasing blood flow and circulation. Research and investigation on the effectiveness of this herbal equivalent of Viagra still continues, and men are advised to follow the advice of their personal medical team regarding dosage when considering it as an option. Now we come to option number 6, AWT. This last option I'd like to cover in this video is, in our opinion, one of the best methods for men to consider when fighting either erectile dysfunction or Peyronie's disease. This option is drug-free, pain-free, needle-free, and surgery-free, and is popularly known as acoustic wave therapy, or AWT. The AWT procedure involves using a sound wave generating probe that emits low-intensity but high-frequency acoustic waves. This probe is applied directly to the penis through multiple sessions lasting 20 to 30 minutes. The acoustic waves stimulate the penile area to develop new blood vessels and rejuvenate erectile tissue in the affected parts of the individual's body. This promotes blood flow and makes it easier for the individual to gain a stronger, harder, and more sustainable erection. Not only can AWT be used in combinations with other forms of treatment, but it has yielded impressive results for many patients just by itself and with no known side effects or pain. Also, as acoustic wave therapy alters the penis itself, it's considered a long-term solution compared to many of the other available treatment options. At ARC Men's Health, we're an exclusive provider of Swiss Wave Protocol, which is a unique form of acoustic wave therapy. It requires a highly calibrated Swiss-made medical device cleared by the Food and Drug Administration, or the FDA, for use on the human body for soft tissue repair and improved blood flow. The Swiss Wave Protocol has been successfully administered to thousands of men with ED worldwide and has also been effective to help men suffering from Peyronie's disease. I hope this video was useful in giving you a brief overview of treatment options. Please check out our other informational videos and articles about ED, available at arcmenshealth.com. To learn more about the Swiss Wave Protocol, contact our medical team via the website. Thanks for listening.